Don't make me make you clap. Thank you very much. Very good. Very good. My name is Tim Markle. I work with the Waisman Center. I've been working here for 16 years, mostly in the areas of working with children and youth with special health care needs and their families. For the last few years, I've been really looking at the transition between childhood and adulthood, between adolescent and adulthood. This coincided with the burgeoning adulthood of my son, who is now 28 years old. He's on the autism spectrum. He has some mental health challenges as well. And so I come to this as a parent and also as a professional. So what I want to talk to you about is something else. But first, I want Briana to introduce herself. We just talked beforehand. I'm like, do you want to introduce yourself first? Sure, that'd be fine. And then I'm just not going to do it. So go ahead.
Hello, I'm Briana Swanson. I'm a nurse practitioner with the Adult Congenital Cardiology Clinic here at UW. And I also have implemented our transition clinic program here at UW, the kids, with the little kids. So
what we're going to do is we're going to start from this big picture of healthcare transition for everybody and narrow it down into our cardiac kids. And so I'm going to take care of the big picture because I don't know anything about cardiology. So could you handle that part?
I think I can.
Okay, that'd be fantastic. So I'll talk more of a generalist. Is when we talk healthcare transition, we're talking about this model that moves from a pediatric care model into the adult care model. Okay, now I want you to understand that it's not that adult care is this cold, awful world. There are some fantastic adult care doctors out there. But let's consider for a moment the world that our kids are spending maybe 18 years in. Okay, they're very friendly. They smile a lot. The rooms have colors. Have you ever ask a kid their favorite color and they say beige? That's who designs hospitals. That child will then grow up to design hospitals. Is we have colors, and so then there's this change that happens. We're building these relationships. And it's been going on. The doctor talks mostly to the family member who's there, to the adult, and the child sits there and gets to play with things. And it's a really wonderful, enjoyable experience. And it all comes to a screeching halt. Because what happens is there's a difference in the way that medicine is practiced. In the pediatric care, it's all about how is the disease in the development of the child? How are they developing? How's their body developing? How's their mind developing? When we get to adulthood, it switches, doesn't it? We're talking about how are we declining? So we move from developmental doctors to our declining doctors. It's a change in the way that they see the medicine. It's also a change in the way that sometimes the medicine is delivered. I know parents with their pediatric kids, they come in and they see the doctor, they see the nurse educator, they get their blood drawn, they get their labs drawn, maybe they get a massage, and it's all there. And then when a kid turns 18, who are you here to see today? Well, I'm here to see the doctor, my cardiologist. Okay, great. So you see your cardiologist. Well, don't I see my nutritionist too? No, you got to have another appointment to see your nutritionist. Oh, okay. Well, did you have your blood drawn before you got here today? No, they always drew my blood for 18 years. They've drawn the blood when I've arrived. Oh, you should have had that done 2 weeks ago so we could have the lab results. There's so many changes that we need to prepare our families and our children for. And so that's what we're talking about. And what we're saying is that this could be a planned, structured process. Is every single medical clinic out there has a chart that tells you the exact day and minute that child turns 18. Doctors are never surprised. Clinics are never surprised when a child turns 18. They've been aware of it. As a parent, I was not surprised when my child turned 18. I knew it was coming, but I certainly didn't know what it involved. And so let's talk a little bit about what we are talking about, 3 parts healthcare transition. Okay, this is where you get involved. Okay, hold up your left arm, put it like this. Very good. People at home, you are doing this too. Mark, I see you. Okay, so he's got his arm up now. Now, put your finger over at your elbow. This is birth. Exciting, isn't it? I know. How many decisions do babies make at birth? Very precious few. How many things can they take care of? Very precious few. At birth, the parent, the doctors, the support system, they are doing it all. And then our kids get older, move your arm up, and let's stop at about your wrist. We get to about teenage years. Okay, you can put your arms down because it's going to get tired. I'm going to keep mine up. Okay, so we get to be teenage years. Hopefully in this time, we've taught our kids how to make decisions, right? What clothes to wear. When it's colder out, you wear a heavier coat. They don't always listen, but we help them to make those decisions based on what their needs are. So we're hoping they're making their decisions. They're learning more and more about self-care, which for some of our kids takes longer than others. But our goal is that when they hit this teenage years, that they have more decision-making power, that they have more knowledge about their bodies, that they have more knowledge about their disease progression, their disability. They have more knowledge about what their goals are and how they're going to reach those goals. And so put your arm back up, because what happens is then bring this arm, put this arm like this, is what happens is we have a transfer of care. Okay, take that arm down. This transfer of care is when this child is moving from that pediatric care system into the adult care system. Okay, you can put your arms down because again, it will get tired. This change could happen for a pediatrician or an adult care provider. They may have an entirely different person watching over their entire body of care than they had for 18 years. Parents have troubles finding who that doctor is. Who are they going to trust next? It can be a very anxiety-filled time for the families. Also, the specialist may change. You may have to move from a pediatric cardiologist, a pediatric endocrinologist over into the adult world. And what if you don't know that person? You're hoping that you have a team that will introduce you to that other side, so that you don't feel like, and this is some families tell me, it's like they're being lobbed into the adult world. Oh, by the way, I can't see you anymore. Oop. Oh, by the way, I only see pediatric patients. Oop. Oh, by the way, you can't go to the American Family Children's Hospital anymore, where everybody knows your name and it's really happy and there's movies and everything. You're going to the other hospital. Okay? Big changes happen. Now, put your arms back up. Okay, so we got our growth. We're up into our skill building times. We have our transfer of care. Then what happens? Move this arm like this. This is now the rest of your life. Okay? This is where our kids are spending the most of their time in our adult healthcare world. So they move here, they transfer, they're here for the rest of their life. So what's the point of this? The point of healthcare here is to prepare them for this, so that they can take care of themselves, take care of their health, take care of their bodies, interact with the supportive healthcare system that's out there, let people know what their problems are, be able to speak up for themselves, become self-determined in the way they want to live the rest of their lives. So what I am saying is that we need to do a better job of this position right in here, this time right in here. What are some of the skills and knowledge that we could build so they could succeed in adulthood? Having that time alone with the doctor. Learning that that's my doctor talking about my health. It's not my mom talking about my health. It's me. It's my health, my body. Starting by making your own appointments. We were talking earlier, with my kid, it was a matter of I first had to teach him how to dial a phone. That's how old I am. And that's how old he is. These days, it's teaching how to go on my chart. Which then includes passwords and all that. We're not going to get into that. Teaching them who do they contact in case of an emergency? What's the difference between a headache that I just call down the hall and say, honey, can I have an acetaminophen, to I go to the urgent care versus I need to call an ambulance? Who's been making all those decisions? You're going to the doctors. You're going to the urgent care. We're going to make an appointment. We're calling the ambulance. It's been done to them, and we want them to understand when they need to start to make those decisions for themselves. Know my medications, why I take them, how to refill them. I went away to college, and my prescription fairy did not follow me. For the first time in 18 years, I did not have my medicine. It was really weird, because for 18 years, I would go to the medicine cabinet, which used to be a thing, and there would be medicine every time. We have to teach them these small steps. How do I pick up that medicine? What do I do when it says expired? Who do I call? Do I call the pharmacist? Do I call the doctor? Do I just not go? Do I just not fill it? That's what my kid did. He's like, well, yeah, I ran out. How long ago? 6 months. Well, why didn't you tell me? I didn't want you to be mad. That tells you the sort of parent I am. Thank you very much. My parenting book will be coming out next month. But because he was anxious. because he didn't know what to do, and I didn't do an adequate job of letting him know that it was okay and how to do those things. Understanding how health insurance works. We want all that information on the health insurance card, along with who's making those medical decisions. Who is now saying, I'm going to have this surgery versus I want to wait. Who's made all those decisions? You're having the surgery. This is what's happening. You're going to the hospital. This is what's going to happen to you. Oh, you get to decide. So do I want that surgery? What's the benefits? What's it going to set me back? Is this the right time in my life to have that surgery? If they've never practiced making life decisions, they're not going to be very good at it. They're going to be really anxious about it. And so helping our kids to make those decisions, engaging in that decision making so that they can feel more confident in the decisions that they make moving on through adulthood. And then one of the most important things we talk to families about and to youth about is, yes, we live in an electronic world, but you're going to go on vacation. You're going to go places where they're not going to be hooked up to your medical record. If you have important things that you want to make sure that that doctor, if you go into that emergency room in the Bahamas someday, that you would go, not in the emergency room, but the Bahamas, that you would be able to sit there and go, here's the important things you need to know about me. Because their chances are they're not going to be able to hook into the UW my chart. And so those are some of the big things. So Briana, tell us a little bit more about the cardiology part of it.
All right. So thank you, Tim. That was wonderful. I'm just going to dive a little bit deeper, thinking now with a congenital heart disease lens. So, yes, I am an adult congenital heart disease nurse practitioner, and a lot of what I do is with adult patients. However, beginning in 2020, we implemented the transition clinic within the PEDS cardiology clinic at UW. It first started out with just 17 and older because that's all the bandwidth we had. Currently, we're at 12 and older, which is what is recommended for, if you look at any transition guidelines. So if you have a patient, or you're the patient that has a pediatric cardiologist here at UW, you may see this added visit called adolescent education, and it's a nurse visit, but that's what it is. That is healthcare transition. And so we quickly learned when we implemented this clinic that healthcare transition is a scary concept. So we quickly changed it to adolescent education, because adolescent education is really truly what we're trying to do. So we're starting the conversation as early as possible to encourage families, patients to start thinking about, how can I advocate for myself? How can I be prepared as an adult to care for myself eventually when I am older? So truly, the spectrum starts around age 12. Obviously, every child is unique and different and is ready at their own time. And really, it goes all the way until age 26. So we are also trying to have some of these follow-up meetings, even in our adult clinic, because just because you transfer over to the adult clinic does not mean that the problems go away. So we are also aware of that, and we're trying to have some of those conversations in the adult clinic too, to make sure that all of the needs are being met. But regardless, the very basic at age 12, we would like to focus on talking to the child and have the child start to think about what is their heart condition. And if possible, what surgeries did you have? It is amazing we have a medical summary that we try to recommend for every child. Many of them have electronic devices. And so there's a medical summary that's on a phone, and that we actually step by step have them enter in their medical information on their phone. And when I first started the clinic, I'd be like, okay, here's your job. You need to do this in the next year, and then I'll follow up. Well, I quickly learned that wasn't happening. And so then now in the clinic, we are verbatim telling them what to put in there. And you'd be amazed by how their little eyes light up, because they can actually see how it's spelt out. rather than just this vague word of, oh, I have hypoplastic left heart syndrome, or I had a Fontan. They actually can see it written out. It is amazing how that, just actually visualizing it, rather than having some other provider talk to mom or dad or some guardian, can be so empowering. Just seeing that word. And knowing that they have access to find their own health diagnosis and surgeries is amazing. The other thing that we have encouraged is with these IEPs, you can have that built into their IEP. So you could have them be included to, Susie, show me how you would access your medical information in case of emergency. So say mom, dad is not around, right? That is going to happen as they continue to age, but you can build that into the IEP and educate and coach them into how to identify their medical summary. And having access to that information is the very first step, I would say, of empowering your child to start learning about and feeling encouraged about their own health. Then we it's like based on general ages that we start to like build more and more about transition of care. But like, what symptoms should you report? Should you start speaking up to mom, dad, whoever that might be, to say like, hey, I had some palpitations the other day and that's not normal, or they're happening more often. I need to tell mom about it. As you get older, then we start talking about, hey, like you will need lifelong care. And there is a difference between regular heart doctors and then there's adult congenital heart doctors. And here at UW, we do a fabulous job of making sure that you're going to get placed with the adult congenital group. But that's not always the case. There's many individuals that have complex congenital heart disease that are getting cared by a regular adult heart doctor. And that is what we are trying to change and help, because that's all we do is adult congenital heart disease. We know the complexity of your own heart condition. So we want to just make sure that the child understands that, though, right? That there are specific people that will be needed as you continue to age. And then like the basics of everybody, but then more important within congenital heart disease of just making sure you have good oral hygiene. Are you staying healthy? What about your nutrition? We do start talking about insurance. And filling a prescription. What about, do you have an alarm on your phone to help take your medications? So as a parent with a child with congenital heart disease, starting those conversations around age 12 can be very valuable, and then continuing to expand. So for example, if you do have a child that has a prescription, you can start encouraging them to maybe have an alarm or have a little checklist that they can actually check off and be like, yep, I took my lisinopril or I took my aspirin. And then as like around age 15, 16, 17, then you can start showing them, how do you actually get a refill? What does that look like? Because say they do eventually go off to college or leave the house, whatever that might be, they need to know how to get that medicine. So they aren't doing it by themselves for the first time, right? Do it together. That's what we want. We want you to show them, do it together, and then they can do it. So we're just trying to plant the seed so that we can foster the best trajectory. Kind of like what Tim was saying though, like this can be high stress for the transition period, especially as we get closer to 18 years old. And so if we start these conversations younger, it can be not as overwhelming when they become 18 years of age. Here at UW2, we do not have a policy where we say, if you're 18 years old, you got to move on to the adult care. We do not have that policy within our congenital clinic. It's all individualized and we figure out what's best for each child. So just keep that in mind too. But here's just some things to point out. There's new relationships, people might be moving, trying to navigate healthcare, which is complex, even if you don't have a complex congenital heart disease or other subspecialties. There's new financial responsibilities. People expect some independence, whether or not that's necessary or at what level. And mental health is a real thing. We have a grant within our transition clinic, and of those that we have studied or interviewed, 9 out of 10 children have reported some form of anxiety or depression. It is a very real thing. So this is just to kind of recognize how it is a very scary, stressful thing for patients and families, and we're trying to help kind of mitigate that to the best of our ability. And just very briefly, moving over to adult congenital heart disease. I already told you about that there's difference between regular doctors and congenital heart disease, adult congenital heart disease doctors. But for all your specialties, finding the right doctor that fits for you. It may take a little trial and error. You may have to go meet an adult provider, and if it does not feel right, it is okay to try a different provider. It is okay. It is hard, and just give some grace and know that it will take some time too, right? Because you have such a relationship with those pediatric providers. And then in Wisconsin, there are 2 healthcare centers currently. We're one as a whole, but 2 centers, UW Health, and then the Children's of Wisconsin have adult congenital heart disease. So just know that if you live more in a rural area, we have outreach clinics, but you can't necessarily go to some hospitals in other areas. So that's Madison and Milwaukee. Like, say you lived in the North Woods, there's not a designated adult congenital heart disease team in that area. And why does that matter is, as depending on the severity of the congenital heart disease, it really is important to make sure that you are having the team that knows how to manage that person best, because of all their complexities, and maybe they need different anesthesia, or maybe they have access issues, or how to even process where to go. People aren't fully aware. So I could talk about this all day long. But so if you guys have questions, just know that we are here, and here's our contact information, which will be in the PowerPoints. Here are some amazing resources I just want to quickly identify. So the Adult Congenital Heart Disease Association has a great link for identifying clinics for adult congenital heart disease. So, and it's for the United States, and it will say if you're accredited or not, meaning that you have all the viable resources for these complex congenital heart disease patients. So they are amazing. Conquering CHD is amazing. I am supporting them. But they actually have lots of great resources for specific transition tools for congenital heart disease. And then got transition, and then the Weizmann Center. So questions? Let's